Welcome, Ursula.
Hello, Gemma.
Absolutely delighted to have you on here today.
Thanks very much for having me. Delighted to be here to get a good chat about perinatal.
Definitely all things this week, especially.
hmm
Absolutely thrilled to have you on. I know who you are and you do a great job within the Southern Trust. So I'm going to let you introduce yourself and just give us a wee background about where you've been and what you've been doing within your role. I'll hand it back to you, Ursula.
Okay, so my name is Ursula Tumelty. My title, and these are great things, aren't the titles? I'm the clinical lead and the service coordinator for perinatal. And what I'll often say to people is I'm just all things to all people. We get stuck in and get things done. My professional background is in mental health. I'm a mental health nurse. And when I came and joined the perinatal team, I was new to the Southern Trust. So I'd previously worked in the Belfast Trust and the Southeastern Trust in several different mental health services. So I worked in acute wards, I worked in crisis mental health teams, and also in rehab, which is for people with serious mental illness. And I have an interest in managing complex cases, and also having worked for so long in a service area where really our bread and butter is suicide, then it's important to me to work together in reducing that, and particularly in perinatal. One of the reasons that they're here is that there's far too many women die because they take their own life in this period. So it certainly sparked my interest, and the idea of working with women and babies was just, really, really important to me.
And how long have you been in your post now, Ursula?
So I've been in my post since February 2022. I was the first
Brilliant.
person employed in the team. So at the beginning, we only had myself, a midwife, a health visitor, and a CPN. And for various different reasons, due to funding, we didn't have a fully operational team. And the four of us kind of worked away together for about 6 months. And then in January 2023, employment was done. We had our consultant psychiatrist. So January this year was our full first year of operation. Um, in the Southern Trust.
That is brilliant. And you're doing a great work, especially with our mummies here coming through.
Yeah, we try
Yes.
our best. There's a lot of we get a lot of referrals, and we're beginning to pick up where the kind of issues are and what's coming through. It's maybe important to note, Gemma, that when these teams were first set up, I mean, this was a big missing piece in mental health services. Perinatal existed in England. Again, it's very new. It's probably only been up and running for 10 years, which is a bit sad for women, isn't it? And it only came here really in 2022. But in terms of perinatal, they were set up for women who had SMI. SMI is serious mental illness. That would be schizophrenia, bipolar psychosis, or purple psychosis. But in fact, these women make up a very small portion of our caseload. The vast majority of women, it's around anxiety, birth trauma, and grief. So even with us being here, we're able to see where our services need to be and what we need to be doing, because the reasons that we were set up or the thinking around it is changing and evolving as we move on.
Yeah. Thank you. Thank you for that update. Yeah. So, why have you agreed to come on, particularly this week of all weeks, to talk to us and give up your time? Because I know you're very busy. Why did you agree to come and talk to us?
I mean, this promotion of the service in any way, shape, or form is great. For me, in terms of mental health, it's about reducing the stigma. Stigma is one of the biggest barriers for women coming forward, and that's at any level within the service, not just to ourselves in perinatal, but coming forward and saying, I'm not okay and I need some help. And it's really great to have this week where we can hear the stories of women in our caseload, we can hear what's out there and encourage women to come forward. There's no such thing as perfection, and I think that's one of the key messages as a team we give our mummies. There's no such thing as the perfect parent. That's a beginning, and if you're struggling, then come forward, and there's lots of help that's out there. From my own perspective, it was about, I suppose, letting people know that we're here as a team and what we do, because we are set up. I suppose it's moderate to severe would be in the criteria, but we offer so much more in terms of signposting women. Within mental health services and also within the wider community and voluntary sector.
Brilliant. So, how does your team support women with their mental health?
We have a large multidisciplinary team. It's quite unusual in mental health services because within our team we have our own midwife and our own health visitor. So they're two very different professionals, but they're integral to what we do. It's a wraparound intensive service. There is community psychiatric nurse, there's social workers, there's an occupational therapist, there's a health visitor and a midwife. We have a psychiatrist and psychology as well. So if I was to describe a typical journey, a woman is referred in antenatally. She will be picked up by our midwife, Leanne. Within maternity services in Craigavon, there's an obstetrician who is specific mental health clinic. It offers continuity for the woman within that period. A key worker is appointed. That's usually either the psychiatric nurse or the social worker. And that's very important to have somebody that's holding the care. A lot of what we do is about communication. And we look back at, where incidents went wrong. It's because these women had nobody, there was no communication. Nobody was like really holding them. So it's a lot of this is about containment. We can then provide in the postnatal period, we have our health visitor, and she can provide specific interventions. The core health visitor will remain, but Mary can provide core interventions in terms of bonding, in terms of motherhood. She provides group in the Incredible Years program. Baby massage is one of the really important interventions that we use, and again, our key workers are trained in that as well. We've an occupational therapist, and that's around helping women with their function, with organisation, postnatally. And if you're experiencing anxiety, depression, or any type of mental health issue, then things like that things can come on top of you. And it's about getting organised and simple things like getting a bus. Sarah will support like that, meal prep, organisation of the house, and she can offer so much more in terms of sensory. Um, Interventions as well. And we then have our social worker, and she would become involved where there's a social work need in terms of women who maybe have housing difficulties, who are experiencing domestic violence, who have maybe a history of being known to family and childcare services. Then our social worker will take on that role, again, offering the continuity and containment for them. We very much operate on a think family level. So yes, we have mum and baby, and we hold mum and baby at the centre of what we do, but we look at the wider family, and that's within mental health services in the Southern Trust. So we think about dad, we think about other children in the household and the impact that it can have on them. So the service is really aimed. It's quite an intense piece of work. These women will see us a lot, and the reason that's the reason why it's with moderately to severely unwell women, because that's where the need lies.
Such great teamwork, everybody doing their specific job. It
hmm
sounds brilliant for those mummies who need it. So, just thinking of somebody who's listening online now, Ursula, who don't meet the criteria and maybe just are struggling with their mental health,
Yeah.
what would you say, or how can you signpost them from today's recording?
So we would always encourage referrals regardless. So our referrals come via GPs. They come directly from health visitors and midwives. Um, and we will take a long time to go through those referrals and try and decipher. And it is challenging at times. So if we make a decision just to begin with that maybe no, not at this point, we can't see that would meet our criteria, they're always open to be referred back in again. It's never closed. It's never, no, that's not for us. Within mental health services, we're very lucky in the Southern Trust. So, in mental health services, in the primary mental health team, and there's another team called Steps to Wellness, and they offer specific work for perinatal women who are in the low to moderate. So, we can signpost into those teams. And again, we're very lucky that they've worked really well with us as a team. So, if a midwife sends in a referral and we think this is low to moderate, this will sit within Steps to Wellness, then we can refer directly to them. There's no delay in that referral going back and then having to go again. We then link in with them because things can fluctuate and change quickly, and we recognize that. And if they think then that they're not meeting the level, then it can come back into our team. So we kind of try to create a flow. Um, we use the Aware, and I know you spoke to Aware yesterday, and also PIM in the community and voluntary sector. And again, in the community and voluntary sector, there's lots of good counselling works going on. Centred Soul in Uri would be one that we would use. The Chrysalis Women's Centre in Lurgan, just to name a few. Um, Now, we wouldn't refer into these services, but we work very closely with Sure Start and Home Start as well. So again, the key sometimes is about communication, and it's about getting women pointed in the right direction and knowing then that we're all communicating together. So should anything change, then it's back to us. So that's a real key in the service.
Thank you. And that is important because I know there's probably people who are listening who are in the early stages and maybe they're just struggling with anxiety or low mood and they just don't know what way to turn.
Yeah.
If you any tips or advice on what you, within your professionalism, would recommend even for Joe Blogs who's stressed about something or need encouragement from their mental health point of view?
Always reach out. And I'm going to go back to my original point around the stigma, which is crippling really for people. Um, we're here to help. There's people here to help. So reach out and let us know. For lots of people, the first point of contact will be a family member or a friend. It's always good to have somebody that you can turn to. Again, another thing we will often say is whatever it is that you're thinking inside your own head is potentially not the reality of it. Even the act of just saying it at a very low mental health promotional level, just having somebody you can talk to. And once you do that once, it probably will make it easier. Reach out to your GP surgery. They can signpost into us, and then use the services that are there. But always reach out and say, and never be ashamed because there's no shame in this. In fact, it would be the stronger person and the more resilient person that would be reaching out and telling us that they don't feel right and things just feel wrong.
That is so good. It really is. Just so people know that there is help there.
Yes.
Um, and your team are doing amazing work, and I really appreciate your time. Is there anything else you want to add, Ursula?
There's just that it's been, I mean, I think I've said this to you already. It's been a huge privilege in setting up this team in the Southern Trust and for the women that we've worked with and seeing them come through and seeing the difference that we have been able to work or to do. It's a work in progress. And my hope for the future of perinatal services and for women of all levels is that this will only expand and improve. And then every we'll be able to take more people into the service and look after them. So watch this space. We'll start advocating for that, Gemma, getting more money and getting our services bigger.
Definitely, Ursula. Oh, listen, thank you so much for your time. I really
No
appreciate it.
bother. Thank
Thank
you.
you.
All right.
Thanks.
Bye bye.
Bye.